Hello, my name is Dr. Margaret Antai. I am a plastic surgeon living and working in Nigeria. In this video, I want to discuss something that is extremely important, and that is the process of consent. Consent. Now, what is consent? Consent is that process where you have a discussion with your healthcare provider. Doesn't have to be a doctor, but every healthcare provider will usually get consent from you. That is, they go ahead to go do any procedure at all. So in surgical practice, we do that as well. So when you come in for your consultation, the process of consent for that surgery will be one of the things that will be discussed. Now remember that you have presented yourself for care shows that yes, you have given the go-ahead for certain things to happen. But before something as invasive as a surgical procedure can be carried out, it's important for us to have a discussion with you, and then you can decide if you want to go ahead with that procedure, because other options will also be tabled before you if there are other options for whatever your problems are, and then you can decide whether you still want to go ahead with the procedure or not. So usually the consent, we will discuss the procedure that we are going to have, what we have found out, and what procedure you need. And if there are other procedures that we feel you may need, things that may come up in the process of doing your surgery, we will also discuss those things with you. Because should you be under anesthesia, I know that not all anesthesia means that you are knocked off and sleeping, but usually it is not the ideal place to take consent on the table, especially when it's not a life-threatening thing. But sometimes there is an urgency that needs to be addressed when you're on table, and at that point in time, you may not be able to take a decision. So some of these things, if we anticipate some of those things, we will discuss it with you at that consent meeting, and we'll let you know what other possible surgical procedures can arise. Now, the other thing that is very important is for us to discuss the benefits of the procedure that you're about to have. And very, very importantly, the risk of the procedure that you are going to have. What are the things that could go wrong? Because every surgery has things that could possibly go wrong. There are so many things that could happen in a surgical procedure, no matter how beautifully it is carried out, no matter how qualified and skilled the surgeon is, no matter how nice the facilities are, there is always a risk that something could go wrong. And that risk needs to be discussed with you. Now, there's the point where I usually get a bit frustrated, especially with us Nigerians, because we are extremely superstitious and we are also very, very religious. And sometimes before you get to your doctor, I understand that you may have had some consultation with your clergyman. They may have had some discussions with you. I'm not going to go into the intricacies of that. But sometimes patients, in my experience, don't want to hear about what could go wrong. You hear things like, God forbid, doctor, it's not going to happen. Please don't say it again. It is not my portion, and all of that. But I'm here to tell you, whether you believe it or not, whether you accept it or not, there is a chance that something could go wrong with your surgery. And it doesn't mean that the doctor doesn't know what they're doing. It doesn't mean that the doctor discussing what could go wrong is trying to be push you away and not allow you have your procedure. It doesn't mean that the doctor is trying ahead of time to, to cover for his mistakes that he feels his lack of skill is going to bring up. No. It is your right to know what can go wrong in your procedure. So the doctor is doing you the duty. He owes you that duty. He or she owes you that duty. That is why you see us going ahead to discuss what can go wrong. If a doctor does not discuss with you the things that can go wrong in your procedure, please do well to ask that question during your consultation, during that consent. Please, doctor, what can go wrong in this surgery? What are the possible things that I need to look out for? There are so many of those things that can come up in your plastic surgery procedure, either cosmetic or reconstructive, and I'll be addressing some of those things in another video. So please, this, I hope, has addressed a lot of things. The doctor is not trying to make an excuse for incompetence ahead of time. The doctor owes you a duty and is just doing his duty. So let's try and be safe, because your safety is first. You need to be safe. You need to come out alive so that you can enjoy the results of your surgery. So thank you so much for watching. Please do like and follow this page, and I'll see you in my next video.